Hey guys, this is student nurse Jana and today we'll be talking about bleeding disorders. But before that, let me give you an overview about platelets. What are platelets? Platelets or thrombocytes are tiny blood cells that help your body form clots to stop bleeding. If one of your blood vessels gets damaged, it sends out signals to the platelets. The platelets then rush to the site of damage, forming a plug or clot to fix the damage. The process of spreading across the surface of a damaged blood vessel to stop the bleeding is called adhesion. This is because when platelets get to the site of the injury, they grow sticky tentacles that help them stick or adhere to one another. They also send out chemical signals to attract more platelets. The additional platelets pile into the clot in a process called aggregation. Facts about platelets. Platelets or thrombocytes are made in your bone marrow along with your white and red blood cells. Your bone marrow is the spongy center inside your bones. A clot is usually called a thrombus. Once platelets are made and circulated into your bloodstream, they live for 8 to 10 days. Under a microscope, a platelet looks like a tiny plate. A normal platelet count is 150,000 to 450,000 platelets per microliter of blood. Your risk for bleeding develops if a platelet count falls below 10,000 to 20,000. When the platelet count is less than 50,000, bleeding is likely to be more serious if you are cut or bruised. Some people make too many platelets. They can have platelet counts from 500,000 to more than a million. What happens if your platelet count is high or low? The health condition linked to abnormal platelets or abnormal platelet counts will be tackled in this video. What is thrombocytosis? Thrombocytosis is a condition in which there is an excessive number of platelets in the blood. Too many platelets can lead to certain conditions including stroke, heart attack, or a clot in the blood vessels. There are two types of thrombocytosis, primary and secondary. Primary thrombocytosis, also known as an essential thrombocythemia or ET, is a disease in which abnormal cells in the bone marrow cause an increase in platelets. The cause is unknown or idiopathic, but possible cause may be autonomous sensitivities to cytokines, decreased effect of platelet inhibiting factors, and defects in the accessory cell microenvironment. Secondary thrombocytosis or reactive thrombocytosis is caused by another condition the patient may be suffering from, such as anemia due to iron deficiency, certain cancer including chronic myeloid leukemia, inflammation or infection, and surgery, especially splenectomy or the removal of the spleen. What are the symptoms of thrombocytosis? Most patients do not have any symptoms with increased platelet count. When symptoms do appear, they can include skin bruising or bleeding from various areas such as the nose, mouth and gums, or the stomach and the intestinal tract. Some patients develop erythromelalgia, causing pain, swelling, and redness of the hands and feet, as well as numbness and tingling. Other symptoms include blood in the urine or stool, lightheadedness, weakness, headache, and rarely chest pain. What are the common medications with this type of bleeding disorders? This includes low-dose aspirin therapy, hydroxyurea, anagrelide, and interferon. What is thrombocytopenia? Thrombocytopenia is a condition in which the body does not have a normal number of platelets in the blood or a condition of a decrease or low platelet count. What causes thrombocytopenia? This includes a bone marrow disease such as aplastic anemia, radiation and chemotherapy treatment for cancer, exposure to certain viruses including Epstein-Barr, cytomegalovirus, hepatitis, and HIV, an enlarged spleen, heredity, exposure to toxic chemicals, taking certain medications such as certain antibiotics, cardiovascular drugs, and seizure medications, as well as drinking too much alcohol. Symptoms of thrombocytopenia includes the following: bleeding on various parts of the skin. You may have small red or purple spots called petechiae in your lower legs, or bruising that is purple, red, or brown, known as purpura. Bleeding that doesn't stop on its own, such as nosebleed or bleeding from your gums when you brush your teeth. Heavier bleeding during menstrual periods, and internal bleeding such as blood in the urine or stool, or bleeding from the rectum. What are the common medications prescribed by physicians with this type of bleeding disorders? This includes steroid medicines to keep your body from destroying platelets if the problem is related to your immune system, and intravenous immune globulin if you can take steroids or if you need a higher platelet count quickly. What is immune thrombocytopenia? Immune thrombocytopenia or idiopathic thrombocytopenic purpura or ITP is a bleeding disorder in which the blood doesn't clot as it should. This is due to a low number of blood cell fragments called platelets or thrombocytes. There are two types of immune thrombocytopenia. Acute ITP generally lasts less than 6 months. It mainly occurs in children, both boys and girls, and is the most common type of ITP. Chronic ITP. This lasts 6 months or longer and mostly affects adults. However, some teenagers and children do get this type of ITP. What causes immune thrombocytopenia? In most cases, an autoimmune response is thought to cause ITP. Normally, your immune system helps your body fight off infections, and in ITP, however, your immune system attacks and destroys your body's platelet by mistake. Why this happens isn't known. In some people, ITP may be linked to viral or bacterial infections, such as HIV and hepatitis C. Children who have acute ITP often have had recent viral infections. These infections may trigger or set off the immune reaction that leads to ITP. What are the signs and symptoms of immune thrombocytopenia? Immune thrombocytopenia may not cause any signs or symptoms. However, ITP can cause bleeding inside the body or internal bleeding, or underneath or from the skin or external bleeding. Signs of bleeding may include bruising or purplish areas in the skin or mucous membrane called purpura, pinpoint red spots on the skin called petechiae, hematoma, nosebleeds, blood in the urine or stool, menstrual bleeding that's heavier than normal, and fatigue. What are the common medications with this type of bleeding disorders? This includes thrombopoietin receptor agonist, high-dose corticosteroids, monoclonal antibodies, immunosuppressants, and intravenous immune globulin. Treatment modalities for these bleeding disorders: platepheresis, more accurately called thrombocytopheresis or thrombopheresis, or commonly called platelet transfusion, and splenectomy, a surgery to remove the spleen. How are these bleeding disorders diagnosed? A physical exam and rundown medical history will be performed. This includes previous blood counts a patient may have had and medications taken, family history of bleeding, and exposure to any blood products such as blood or plasma transfusion. An ultrasound or CT scan. This is to see if your spleen is enlarged or if there are enlarged lymph nodes or signs of cirrhosis of the liver. Certain blood tests, including a complete blood count. This is to see if your blood is clotting correctly. You may need a bone marrow biopsy to check for any abnormalities. Blood smear and genetic testing may also be a possible laboratory test to be conducted. Nursing diagnosis for bleeding disorders. Risk for bleeding related to increased production of platelets. Risk for injury related to bleeding due to thrombocytopenia. Deficient knowledge related to unfamiliarity with the disease condition, and anxiety related to threat or change in health. What are the nursing interventions? During assessment, obtain health history focusing on prior illnesses and episodes of bleeding, past surgical experiences, exposure to toxins or ionizing radiation, and family history of bleeding. Obtain list of current and recent medications, including OTC preparations, herbal and dietary supplements. Perform complete physical examination for signs of bleeding. Observe skin for petechiae and open wounds. Bleeding may be minimal, non-existent, or severe. For minimizing bleeding, institute bleeding precautions. This includes avoid use of plain razor, hard toothbrush or floss, intramuscular injections, tourniquet, rectal procedures, suppositories, and NSAIDs. Administer stool softeners as necessary to prevent constipation. Restrict activity and exercise when platelet count is less than 20,000 cubic millimeter or when active bleeding occurs. Monitor pod count and amount of saturation during menses. Administer or teach self-administration of hormones to suppress menstruation as prescribed. Administer blood products as ordered. Monitor for signs and symptoms of allergic reactions, anaphylaxis, and volume overload. Evaluate urine, stools, and emesis for gross and occult blood. For patient education and health maintenance, teach patient bleeding precautions. Demonstrate the use of direct steady pressure at bleeding site if bleeding develops. Encourage routine follow-up for platelet counts. Educate patient taking interferon for self-administration and managing side effects. Educate patients taking hydroxyurea that CBCs should be monitored. The dosage is adjusted based on the platelet and white blood cell count. And educate client to increase the intake of green leafy vegetables. So those are the first 3 bleeding disorders. I hope you learned something. This is student nurse Jonah, thanking you for listening and watching.